During this portion of the video, I will be demonstrating how to apply garments and pads to a patient that has had liposuction of the abdomen. The garment and dressing application is basically the same for liposuction of the breast. The abdomen often requires overlapping of multiple pads so the entire area is covered. Being careful to cover all incisions with the absorbent material so that there are no incisions present under the plastic border of the pad. Larger patients may require the next size up. If the treated area extends laterally, an extra large or rectangular pad may be needed. Tall patients may require layering with a small or medium pad placed on the upper abdomen. The pad on the upper abdomen is applied first, and then the pad for the lower abdomen. Because the lower abdomen has a large amount of drainage, an HK small pad is placed underneath the larger pad at the bottom edge. With the exception of over the pubic hair, the tape must be secure at all edges without any gaps to prevent fluid from seeping out from the edge of the pad. Another extra small HK pad is tucked perpendicular without tape extending downward into the underwear. This pad should be changed periodically as it becomes saturated. After the surgical areas are covered with HK pads, latex-free netting is applied. Usually a size 9 or 10 is appropriate for the abdomen depending upon the size of the patient. To provide bimodal compression, one HK Optimum breast torso garment layered with compression binders is used for the abdomen and breast, as well as can be used for the flank, waist, and upper hips. It is important that the entire pad is covered with the garment, or it is much more likely for drainage to seep from the edges. So often, an overall garment is required when the hips have been treated. If the thighs are treated at the same time as the abdomen, an overall garment is layered with a torso garment. This is rare with the tumescent technique, as there are limitations in the number of areas that can be treated during one procedure, so not to exceed the established safe dose of lidocaine. Some other garments that may be used for the abdomen area are the HK Optimum torso garment, the HK Optimum tank torso garment, the HK Optimum overall garment, the HK Maximum zipper overall garment, the HK Maximum short zipper overall garment. The torso garments have adjustable Velcro to prevent slippage of the HK binders. 2 pieces of self-adhesive Velcro come with the garment, but must be manually added to the garment after it's on the patient by removing the Velcro sticker backing. Once the Velcro has been placed on the garment, the HK binders are applied over the surgical area. Small medium binders are appropriate for smaller patients, but larger sizes will be needed for larger patients. A 9-inch binder is placed on the lower abdomen, and a 6-inch binder overlapping is placed on the upper abdomen. The binders may need to be readjusted by the patient periodically for comfort. The Velcro will stick to the binder if the binder is removed and must be reapplied with the self-adhesive side placed on the garment prior to placing the binders back onto the patient. The Velcro must be removed prior to laundering the garments. The following items were used in this informational video: disposable exam panties, HK super absorbent pads, latex-free elastic netting, HK Optimum breast torso garment, HK binders,